afternoon, everyone. My name is Megan Nash, and I'm here to talk to you about occupational stress and anxiety in the nursing profession. I'm a registered nurse on an intermediate care unit in Elizabeth City. So, what actually causes stress in the nursing professions? It can be a ton of different things. Heavy patient load, having too many patients without enough nurses or CNAs. Sometimes family members or doctors and can make demands for nurses that are unrealistic. Personal load sometimes can spill over into nursing at your job, and that's true really for any job. Time constraints in nursing, I know in my profession or my unit, a lot of things are due at certain times, and most of the time it is the medications. Or the morning med pass is always at 9 o'clock, and just making sure that you have your patients set up with their medications can be very stressful, especially if you have an unreasonable amount of patients. Understaffing goes with all of this. It's kind of the umbrella. Lack of sleep. We work really hard. 12 hours if you work at the hospital, which is really 13 or 14, and then having to come back in the next day and do it all again. And right now with this COVID pandemic, the lack of personal protective equipment or PPE is really a huge stressor for these nurses that are in the front lines in New York or Washington or wherever, but also here in North Carolina, especially at my hospital. They're really trying to conserve everything they can, and I think that the rules have changed just about every day of how we can save this stuff and conserve it with keeping the nurses safe and keeping the patients not cross-contaminating them. The patient care can be affected by nurses' stress as well. If you have too much on your mind, you might be short to the families or the patients if they're asking questions or they're not doing what you need them to do. There can be mistakes in medication administration, which luckily most hospitals have Epic, which makes it pretty hard for a medication error if you follow what you need to do on the computer and scanning and everything. There can be charting errors if you're trying to fly through your charting and make sure you get out on time because you're tired. And forgetfulness, you could miss things that you wouldn't normally forget if you were stressed out, dropping blood pressure, change in a patient's condition. All these different things can be affected by stress. And one thing that nurses need to know is how to reduce stress. Therapeutic massage is really good. Yoga. These nurses are on the floor of the hospital. I doubt that would really happen in real life, but yoga classes are great. I do yoga myself, actually. Exercising more often is a really good stress reliever. We talked about yoga classes. Making time for your family and trying to find a hobby that will get your mind off of any stress. A massage, we talked about that. And just having a day where you just chill out and rest and relax and just do exactly what you want to do. And lastly, practice the caritas, which is always good that we've learned about. In today's world, especially right now with the COVID pandemic, we have a lot of stress. You can see these nurses outside most likely doing the drive-through COVID testing. And you can also see the skin breakdown on these nurses that have been working in COVID units. And mainly COVID units, but they're requiring masks for all nurses now. You can see the one in the bottom center has a Mepalex on to reduce the skin breakdown there. And the stress levels right now are going to be higher with not just nurses, but all healthcare providers. With this COVID-19, we need to make sure that we're making a conscious effort to reduce stress so we can provide the safest care and not miss mistakes, or, we need to make sure we gown up correctly. We need to be there completely with our mind and able to perform the way we need to do. And last few things, just be mindful of yourself and others. You are important, and a happy nurse is going to make a happy patient. Does anybody have any questions? If you do, please email me, and thank you very much.